Hello, am I audible? Hi, Kinza, how are you? That's wonderful. And how's your preparation going so far? Hi, Michelle. Yes, I'm doing great. Thank you so much for asking. That's perfect, Dr. Kinza. Okay, I think we have enough participants. First of all, welcome everyone to Instutors. So without wasting our time, let's begin today's session. We have been receiving many queries about the updated RCOG curriculum, and we noticed some stress among students regarding this issue. So to address your concerns, our team of Instutors, we have decided to hold a live session on this topic so that in this way we can provide a better support and we can answer all your questions. So over recent years, the Royal College of Obs and Gynae, they have been publishing many articles uh, regarding the strategies, which reports highlights the training needs and challenging in the Obs and Gynae workforce within the UK. And in this way, the purpose why RCOG has updated their curriculum, the RCOG is ensuring that the right people with the right skills are in the right places at the right times for a person-centered care. So by that means, this update is more critical for the trainees who are working in the UK hospital, as it focuses and aligning more on the training skills of the workforce, which is needed in the UK's population and in the UK's healthcare system. And there is a good news: those candidates who are working in other countries and preparing for the MRCOG Part 1 exam might not be directly affected by these workforce planning and details, as these changes are primary concern would be the exam content rather than the specific of the UK workforce training and plannings. So let me give you an overview. What is exactly changing in the RCOG curriculum? So basically, they are trying to introduce a special interest training modules, introduction of special interest in professional modules, development of new training programs regarding the management, skills in the advanced labor ward practice, which is incorporated into the core curriculum of the RCOG. And there are some other minor amendments to the core curriculum. So if you can see here, mostly they are changing the curriculum, which is more specific to the trainees and related to the training programs, which are classically happening in the NHS at the moment. So this gives a reassurance. And what exactly not changing in the RCOG curriculum is the training program, which is core training program structure that would remain the same. Renaming of the training stages, stage 1, 2, and 3. Basically, all these changes, again, they are more relevant to the trainees or the people or the doctors who are going into the training program in the NHS or who are currently working in the NHS. Critical progression points remains the same. Examination requirements remains the same. So let me go back to the slide. So as far as your MRCG1 exam is related, Your main goal is to focus on the knowledge requirement, which is important for your exam. So skip all those points which are relevant for the clinical practice. So in a nutshell, now I want to give you a brief about the MRCOG syllabus, specifically the summary of the MRCOG 1 syllabus. In a nutshell, the MRCG syllabus encompasses 15 core knowledge areas. That means in the exam, you will be assessed in 5 core knowledge areas. And in these areas, your knowledge should be on point. So what are these 5 core knowledge areas? So first knowledge area is your clinical skills. So these CIP points are the competencies in practice. So these are not relevant for you since you are writing the MRCG1 exam in remotely or in your own hometown. So these areas are clinical skills, teaching and research, core surgical skills, post-op care, antenatal care, maternal medicine, management of labor, management of delivery, postpartum problems, gynecological problems. Dr. Aisha, could you please turn off your mic? Thank you so much. Okay, so 9th knowledge area is your postpartum problems, 10th gynecological problems, then subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, and urogynae and pelvic problems. So this is your MRCOG curriculum in a nutshell. So you will be assessed in 5 core knowledge areas. Either you are writing MRCOG part 1, 2, or 3. So this would remain the same. This is your constant knowledge requirement throughout your examination journey. As you can see here, they have written a part 1, part 2, and part 3 as well. So what's the difference here? The difference is in the summary requirement. I will show you a detailed MRCG1 curriculum. Okay. So here I have added all the slides from the 2019 curriculum and 2024 curriculum. And the knowledge requirement doesn't change anymore. 2019 have the same curriculum, same summary, same knowledge points, same subjects. And 2024, I have taken these points from their website. So we are following the same knowledge areas. So let's see the clinical skills, which is your knowledge area 1, what they are expecting from you on the exam day. They are expecting you should be knowing patterns of symptoms and understand the importance of risk factors of different diseases, which are relevant to the obs and gynae practice. Pathological basis for physical science and clinical investigation, and how to interpret results of clinical investigations. So this is your knowledge area 1, and as far as I am observing from this area, it covers your pathology and data interpretation subject. Then knowledge area 2, which is your teaching and research. In this area, you should be able to know principles of screening, clinical trial design, and the statistical method used in the clinical research. That means you should be knowing about the biostats as well. Levels of evidence, quantification of risk, power of study, level of significance, informed consent, ethical regulatory approvals in research. Third point is principles of safe prescribing, quality control in medicine, and the accuracy of tests. So this knowledge area, which is your teaching and research, is all about your biostats and epidemiology. Knowledge area 3 is your core surgical skills, which says you should be able to demonstrate an understanding of the issues surrounding informed consent, including knowledge of complication rate, risk, likely success rates of different gynecological operations, together an understanding of diagnostic method and treatment of complications. You should be demonstrating the familiarity with the surgery by discussing the common operations together with common surgical instruments, sutures. Detailed knowledge of the basic surgical procedures in obs and gynae, for example, low section, cesarean section. You should know every aspect of that surgery. You should be know every aspect regarding the foundation knowledge of hysterectomy as well, which would cover your anatomy, your surgical skills, the basic layers, the anatomy of the anterior abdominal wall, arterial supply of the abdominal wall, and what structures are at risk of those surgeries. So, and what are the post-op complications after those surgeries. Then you should be knowing the principal procedures involved in more complex gynecological surgery for cancer and endometriosis. You should have good knowledge of principle of safe surgery, surgical instruments, sutures, and the management of common complication of surgery. Be aware of the principle of surgical team working, risk management, and risk reduction. Is everyone following me so far? If anyone have any question, please do let me know. Okay, then in your knowledge area 4, which is your post-op care, you should be able to apply clinical science related to the post-op period, including physiological and biochemical aspects of fluid balance, metabolism of nutrients after surgery, biochemistry of enzyme, vitamins, and minerals. And this knowledge area is very clear that you should be knowing basics about biochemistry as well. So here is your another basic subject. Organisms implicated in post-op infections and therapies used to treat them. Therapeutic drugs used post-operatively, including analgesic and thrombophylactic agents. Histopathology of pelvic organs, breast, endocrine organ, including pituitary and hypothalamus, which is very high yield topic for this exam. Classification system of gynecological and obstetric conditions. So this knowledge area covers a bit from biochemistry, a bit from micro, a bit from pharmacology, a bit from clinical management, and a bit from anatomy as well. Then we have next knowledge area, which is antenatal care. And in this area, you should be knowing the basic anatomy of the female reproductive system, specifically more focusing on anatomy of pelvis, perineum, and abdomen. Another thing which is important in terms of antenatal care, you should be crystal clear about the maternal physiology, like what type of changes are happening in a female body during pregnancy. Then pathology of major organ system, including hemoglobinopathies and connective tissue disorder as applied to pregnancy. If you are noticing, this curriculum is all about the OBS and GYNAE. No matter what subject you are studying, either you are studying anatomy, physiology, pathology, micro, everything is more focused on the OBS and GYNAE rather than any other specialty. So please, whenever you are studying for this exam, try to be focused, have a strategic approach, and try to focus on OBS and GYNAE only. Don't waste your time in studying different regions and different subjects. Then you should be knowing a bit from fetal anatomy, embryology, endocrine function, and physiology. Normal fetal physiology and development, together with etiology of fetal malformations and acquired problems, including abnormality of growth. And this will include regulation of amniotic fluid, volume, fetal interaction with amniotic fluid. And this is very high yield module. This covers all of your embryology. Like if you are studying the development of the fetus, you will study all of the system formation, like how the CVS is forming, how the respiratory system is developing, how GIT is developing, how genital systems are developing. So this will cover all of your embryology. And yes, amniotic fluid is very important. It covers a bit from embryology and a bit from physiology as well. Then you should be knowing principles of inheritance and features and effects of common inherited disorders. So now here is your another basic subject, which is your genetics. Basic ultrasound findings in pregnancy, how to define, interpret data on maternal, neonatal, and perinatal mortality, impact of maternal health, and other variables like social deprivation or pregnancy outcome. So this area again covers so many subjects. It covers your anatomy, physiology, embryology, data interpretation, and a bit of biostats. Then the next module, we have maternal medicine. And maternal medicine, you should be knowing pathophysiology and presentation of common infections that affect pregnancy, and treatment and intervention used for these infections. For example, chickenpox. You should be knowing the management. You should be knowing the guidelines, how we manage a patient or a female who is pregnant and who encountered chickenpox virus. Drugs used to treat maternal disease and the potential maternal and fetal complication associated with their use. So I think MRCOG1 exam is a bit straightforward, and if you follow the right strategy, if you have right guidance, you can easily ace the exam in first go, because they have given you all the material, all the guidance, a detailed syllabus, like which topics are important. For instance, if you can see here, they are classically talking about the drugs which are related to maternal health, like what type of medicines are safe to prescribe in pregnancy and what to not, or if you advise those medicine during pregnancy, what possible side effects would be happen on fetal health. So again, there is no need to cover all the pharmacology, just be focused and try to understand and try to remember those drugs which are relevant to pregnancy or the reproductive health. Then we have next knowledge area, which is management of labor, physiology, biochemistry, endocrinology of parturition, including maturation of fetal endocrine system, the influence of hormones on signaling pathway in the myometrium, and the biochemistry of myometrial contractility. So here in this module, in this knowledge area, they have introduced endocrinology, which is another your basic subject. Principles of tocolysis and stimulation of uterine contraction, how physiologically these things are happening, and what type of medicine you can use to make these changes. Then fetal physiology in late pregnancy. It has many SPAs. They can ask you questions in this way, like at late trimester, which organ is well developed, which hormonal changes are going on, what is the level of amniotic fluid at that time. So there are many questions which classically focus in the last trimester. Then placentation and the implications of infection on labor and optical therapeutic options. The next knowledge area is management of delivery, labor, mechanism of labor, physiology of childbirth, and the third stage of labor. And I think everyone is fully aware of that. Then etiology and pathology of congenital and bone malformations of the genital tract, mode of actions of drugs used in labor, at delivery, and in the third stage of labor. Again, they are only focusing on the pharmacology which is relevant to the maternal health. Then biochemical basis of acid-base balance, normal fetal physiological changes in labor, and how to interpret fetal and cord blood analysis. And this is your very high yield topic. There are many questions. The question from acid-base balance, it almost comes in every exam. So this is a very high yield topic. Then female perineum and principles underlying the management of perineal repair. Then the next knowledge area is postpartum problem. Okay, in postpartum problem, they are going into the sequence. Now the mother has given birth to the baby. Now they can ask you question, what type of physiological changes happens in the female body right after the childbirth? What is her TLC level? What is the normal HP level at that time? What is the cardiac output at that time? What is different hormonal regulation is going on in the postpartum period? And if any, by any chance, if any infection happens, if endometritis happens, so what could be the possible positive organism, and what are the management guidelines? And yes, which leads to puerperal sepsis as well. So you should be clear about the management of puerperal sepsis in this period. Okay, no problem, Dr. Kinza, I can repeat. Okay, so next point is postpartum contraception and other drugs used in postpartum and during lactation. So now you can see how your curriculum is again and again focusing on maternal health at different stages. Either she's in the first trimester, either in the second trimester, third trimester, and postpartum period. So you should know every phase of the female cycle during this period. What type of drugs are safe? What are the changes happening in the body? What is her metabolism during these stages? And what are the possible changes right after the childbirth? And yes, contraception is always very important when it comes to the gynecology. Okay, so next knowledge area is your gynecological problems. So we cannot only cover obstetrics for this exam. We have to focus on gynecological problems as well. And one tip here is that whenever you are studying for your exam and when it comes to the gynae, please don't skip the gynecological cancers. They are very high yield. Okay, so in this knowledge area, they are asking about anatomy, physiology, histopathology of pituitary gland and female reproductive tract. And I think this is the third time they are highlighting the anatomy of female reproductive organs, including any understanding of changes at puberty. Okay, am I audible to everyone? Sure, Dr. Bhagya, we can share. Okay. Okay, when it comes to gynecology, we need to understand what is puberty and what is menopause and what is the menstrual cycle, so that we can address the different pathologies or different variations during this period. Epidemiology, microbiology, therapeutics of benign gynecological conditions, including infection. How to interpret results of commonly performed investigations for benign gynecological conditions. Principles of medical and surgical management of gynecological problems, and they are covering your all gynecological cancers, including ovarian cancer, cervical cancer, vulval cancer. Which leads to your next knowledge area, which is subfertility. And in order to address the subfertility issues, you should be knowing anatomy, development, function, and cell biology of the organs of male and female reproductive tract in context to their relevance to the fertility and its disorders. So just studying about the female reproductive system is not enough if you want to address fertility. So you should be knowing the basics about the male reproductive system as well. For example, the basic anatomy, what are the organs, which external genitalia, internal genitalia of the males, consistency of the sperm, normal interpretation of the sperm count, sperm analysis, and yes, some of the drugs you need to study in relevance to the fertility. And in the second point, again, they have written this, how to interpret results of investigations commonly performed as a part of investigation for of subfertility. And when it comes to the, investigation for the male, we go with the semen analysis. So you should be knowing WHO criteria, what is normal sperm analysis and what is abnormal. Next knowledge area is sexual and reproductive health. Again, physiology, endocrinology, epidemiology, pharmacology of contraception, epidemiology and serology of STIs, microorganism involved, drugs used in the treatment, and pathological features of STIs. So this area covers your microbiology. Termination of pregnancy, including assessment, Fraser competency, surgical management, drugs used in medical termination of pregnancy. So any of you have any idea what is Fraser competency? If you know the answer, please drop in the chat box, or you can open up your mic and answer my question. My question is, what is Fraser competency? Okay, you can use Google at the moment. Yes, Dr. Bhagya, that's perfect. You are in the right track. This is something related to consent, but what consent? Yes, excellent. Okay, there's a story behind Fraser competency. I will share in any other live session. It's a very interesting story, how this law came into existence. Okay, so next we have knowledge area 13, which is early pregnancy care. Again, basic sciences pertaining to early pregnancy and its laws, including endocrine aspects of maternal recognition of pregnancy, luteal maintenance of early pregnancy, and physiology of feto-maternal communication. And this is very interesting topic. It covers your endocrinology. In order to address this knowledge area, you should be crystal clear about menstrual cycle. If you know the normal menstrual cycle, then you can easily interpret any abnormality. And yes, you can manage your patient as well. Then etiology, histopathology of miscarriages, ectopic pregnancy, and trophoblastic disease. And this is a favorite topic of RCOG. They love to ask about you regarding trophoblastic disease. Okay, so diagnostic features of ultrasound used in early pregnancy, epidemiology of pregnancy loss, and medical agents used to manage pregnancy loss, such as miscarriage, ectopic pregnancy, and trophoblastic disease. So in order to cover this domain, you need to know the guidelines, the NICE guidelines, how we can manage ectopic pregnancy, because it presents in so many ways. And every presentation have a different sort of management. And yes, when it comes to miscarriages, they will give you a scenario and you have to diagnose what type of miscarriage is that, and then you have to manage your patient. The next point is how to interpret the results of investigation used in early pregnancy problems. Okay, so I'm getting some answers. According to Dr. Halima, Fraser competent is a term used to describe a child under 16 who is considered to be sufficient age and understanding to be competent to receive contraceptive advice without parental knowledge or consent. Yes, that's a perfect answer. Okay, this is our second last knowledge area, which is gynecological oncology. Surgical anatomy of abdomen and pelvis. So this is the fifth time they are mentioning about the anatomy of the female reproductive area. And yes, anatomy of the abdomen. So again, okay, why I'm emphasizing on this point so much, because many students ask this question again and again, that why we are not studying anatomy of thorax, upper limb, lower limb, and head and neck. So here's the answer. In the RCOG curriculum, they have nowhere they have mentioned about the anatomy of head and neck, upper limb, or the lower limb, or the thorax. So you just need to be, again, very focused. Don't waste your time in studying unnecessary material. According to your curriculum, you need to study anatomy of abdomen thoroughly, anatomy of pelvis and perineum thoroughly. Then cellular biology of cancer, genetic origins of cancer, principle of diagnosing, screening of gynecological cancer. And this, mainly the pathology questions comes from gynecological cancers. Munaza, I will be your mentor in your course, and we have a team of doctors. We have Dr. Mehak and Dr. Madhura in our team. They will definitely help you to pass your exam in first go. Okay, pathology and classification system for gynecological cancer, pre-malignant gynecological conditions, and this is my favorite topic. For example, you will get a question. They will give you some 4 options and ask you which of the following is pre-malignant condition, for example, for CA vulva. So in that way, you will get questions. Then you will get some questions regarding staging of different cancers like CA cervix or CA ovary or maybe CA vulva or CA uterus. Okay, then principles of radiotherapy, chemotherapy in management of gynecological cancer and their effects on gonadal function. This is the last area of RCOG curriculum, which is urogynecology and pelvic floor problems. Again, if you want to understand the urogynecological problems and pelvic floor problems, you should be crystal clear about the anatomy of pelvis and perineum, structure of bladder and pelvic floor and their innervation, which covers your anatomy, mechanism of continence and micturition, and principles of pelvic floor support. Again, this is your anatomy and a bit from physiology. How congenital anomalies, pregnancy and childbirth, disease, infection, estrogen deficiency that affect these mechanisms, principles underlying the treatment of bladder, pelvic floor problem, impact of other drugs on the bladder function. So this is all about your urogynecology, and you may need to study a bit from the bladder diary and how to interpret the urogram or cystourogram. So this is your urogyne. So simplify your RCG curriculum. These are the basic subjects which we have extracted from this curriculum. You need to cover. You have to study for your exam. So your foundation subjects would be anatomy, biochemistry, embryology, epidemiology and statistics, endocrinology, which is my favorite subject, genetics, clinical management, physiology, immunology, pathology, data interpretation, microbiology, pharmacology, about your MRCG1 curriculum. So if anyone have any question, you can ask me. Otherwise, I will continue to the next slide. Yes. So these are the recommended books for MRCG Part 1. Oxford Revision Notes and Essential Revision Guide. These both books are recommended by RCOG and they have the RCOG title on their book title. Then for SPA practice, you can study 550 SPS Catherine. However, in Catherine, there are two types of question. One is true false statement question and other is SPA type questions. In this exam, you will get 200 questions and all of those 200 questions would be your SPS question. There is no true false statement question in your exam. However, if you solve this book, you can cover, if you are studying a theory topic, you can easily cover all the high yield points and important points when you are practicing true and false questions on the Catherine book. So that is very helpful. Then exam type questions and pass MRCOG. So these are the books and these are more than enough to pass the exam. But yes, one thing which is over the top of these books that you need right guidance and the right direction and a correct mentorship to pass this exam. Okay, so the next challenging thing, like how I can start my exam preparation and what type of things I need if I wanted to start my exam preparation right now. So the important things you need to study for this exam, you should have a good quality course material. You should have some website access where you can watch the recorded lectures or any sort of authentic study material. Then you should have some study partners. You should have some platforms which are authentic so that you can stay up to date with the latest guidelines. And yes, the motivation is very important. If you join different social media platforms like WhatsApp group or Telegram group, that would give you a sort of motivation and also help to keep you motivated and keep you on the track. And yes, before starting any study for any exam, you need a proper study schedule. So we are excited to invite you to join our premium group, in which we have course material. We offer in our premium group, we offer main schedule and the mini schedule. The main schedule means we have divided all the modules in specific number of days so that you can cover that topic thoroughly. And just to keep you motivated and keep you on track, we also offer mini schedule. That means you will assign a daily task that you have to cover this topic in particular day. Then we arrange live sessions on the Zoom. And later on you will get the recordings of those sessions as well. We have uploaded all the books, all the authentic books on our website. Then once we are done with one module, for example, if we are done with anatomy, let me give you a brief how we are going to study in our premium course. First, for example, we are starting from anatomy, and we have our main schedule. We know that we have 15 days, and in 15 days we have to cover anatomy. Then on the top of that, we will get mini schedule. Now you will be able to know what number of topics I need to cover in a day. Meanwhile, you will have a live session in which we will teach you anatomy. Then later on, if you, by any chance, if you missed your live session due to your busy schedule, you have the opportunity to log in into your account and watch the recorded lecture. Then you can easily go and find the books there in the PDF form. And once we are done with modules, we will do daily Telegram group discussion. We do the daily SP practice. And once we are done with module, we have subject-wise mocks. And yes, we have subject-wise recalls as well. And then another thing I want to highlight here, since you have attended the live session, later on you will get the PDF, which are your mini notes that would help to revise a topic very quickly, and it would save a lot of your time. And these PDFs have all the high yield points which are important to pass the exam. And once we are done similarly with all the modules, which I have mentioned previously, we have 12 modules in the MRCOG1 curriculum. At the end of the course, you will have 3 big mock exams. And I think if you follow this strategy, you will revise your course 3 to 4 times. And I don't think so. If you follow these guidelines in this structure, you will never ever fail the exam. So again, let me repeat. If you have website access, what type of things you will get? You will get books in the PDF form, live session recordings, subject-wise exam type questions, year-wise exam type questions, subject-wise mocks, PDF of all subjects, which are your mini notes, revision flashcards, and the big mocks at the end of the session. Okay, for now, we have a special offer. We are offering our course in just $200 till 10th of August. So don't miss this opportunity and get your booking done. Okay, if anyone have any question, you can ask me. Okay, Dr. Saima, thank you so much for the appreciation. Okay, it depends what type of study material you already have. Okay, Nayab, that's a very valid question. I understand reading too much theory is not an easy task. And honestly, I never recommend my students to go and study theory again and again and memorize all those points, because that's not possible for anyone to retain so much information. So what I always advise my students, be smart and try to focus on SPs rather than going for theory too much. Yes, theory is important for just recalling your basic concepts. And that time would be saved if you just watch the lecture. They hardly for 2 or 2.5 hour recorded lecture. If you watch that lecture and just go through from the your 1 or 2 topics from the Oxford or Essential Revision Guide, that's more than enough. Because at the end in the exam, be realistic. In the exam, you will not get any essay writing exam. So I don't think so it's a wise thing if you study too much theory. Did you get my point? Welcome, Nazia. I hope you will pass your exam in one go. Okay, Nazia, you can contact our backend team. They will provide you with the mini schedules. And that schedule, you will get a full detail of all the topics which are important. Uh, Dr. Munaza, this course will remain valid. Your access would remain valid till your exam day. Dr. Munaza, I can understand. You may contact backend team and discuss this further. No worries. Dr. Farah, okay. If you want us, we can share the feedback of students who were our previous students, so that your query would be settled. Okay, backend team, please contact Nazia and help her. And yes, Dr. Farah has some question regarding our feedback. Please do contact her as well. Okay, for technical support, we have these two numbers. We have our email address, and also we have our Facebook page. If you want to contact us or for technical support or for your any other query, please don't hesitate to contact us. And I hope I tried my best to address your queries regarding RCOG curriculum. And still, if you have any question, please, you can ask me. And yes, I remember someone was asking me regarding knowledge area 7, which they have missed due to connectivity issues. Let me go back to my slide. So this was the knowledge area 7 regarding management of labor, in which you need to cover physiology, biochemistry, endocrinology of parturition, including maturation of fetal endocrine system, influence of hormone signaling pathways in myometrium, biochemistry of myometrial contractility, principles of tocolysis, stimulation of uterine contraction, fetal physiology in late pregnancy, fetal assessment in late pregnancy, placentation and implications of infection on labor, and the optical therapeutic options. So this was your knowledge area 7, which covers a bit from endocrinology and physiology and biochemistry. Sure, Nayab, we can share. Okay, I think we are not getting any questions anymore. So goodbye until next time. See you in the next session. Bye-bye.